Tuberculosis, TB, overview. Tuberculosis, TB, is a potentially serious infectious disease that mainly affects the lungs. The bacteria that cause tuberculosis are spread from person to person through tiny droplets released into the air via coughs and sneezes. Once rare in developed countries, tuberculosis infections began increasing in 1985, partly because of the emergence of HIV, the virus that causes AIDS. Many tuberculosis strains resist the drugs most used to treat the disease. People with active tuberculosis must take many types of medications for months to get rid of the infection and prevent antibiotic resistance. Although your body can harbor the bacteria that cause tuberculosis, your immune system usually can prevent you from becoming sick. Signs and symptoms of active TB include: tuberculosis can also affect other parts of your body, including the kidneys, spine or brain. The Centers for Disease Control and Prevention recommends that people who have an increased risk of tuberculosis be screened for latent TB infection. Include protected health information. Information and will only use or disclose that information as set forth in our notice of. Our House Callie newsletter will keep you up to date on the latest health information. Tuberculosis is caused by bacteria that spread from person to person through microscopic droplets released into the air. This can happen when someone with the untreated, active form of tuberculosis coughs, speaks, sneezes, spits, laughs or sings. Most people with active TB who've had appropriate drug treatment for at least 2 weeks are no longer contagious. Since the 1980s, tuberculosis cases have increased dramatically because of the spread of HIV, the virus that causes AIDS. HIV suppresses the immune system, making it difficult for the body to control TB bacteria. As a result, people with HIV are much more likely to get TB and to progress from latent to active disease than are people who aren't HIV positive. Tuberculosis also remains a major killer because of the increase in drug-resistant strains. Over time, some TB germs have developed the ability to survive despite medications. This is partly because people don't take their drugs as directed or don't complete the course of treatment. Drug-resistant strains of tuberculosis emerge when an antibiotic fails to kill all of the bacteria it targets. The surviving bacteria become resistant to that drug and often other antibiotics as well. Some TB bacteria have developed resistance to the most commonly used treatments, such as isoniazid and rifampin, Rifidin, Rimactane. Some TB strains have also developed resistance to drugs less commonly used in TB treatment, such as the antibiotics known as fluoroquinolones, and injectable medications including amikacin and capreomycin, Capistat. These medications are often used to treat infections that are resistant to the more commonly used drugs. Anyone can get tuberculosis, but certain factors can increase your risk, including: without treatment, tuberculosis can be fatal. Untreated active disease typically affects your lungs, but it can affect other parts of your body, as well. If you test positive for latent TB infection, your doctor might advise you to take medications to reduce your risk of developing active tuberculosis. If you have active TB, it generally takes a few weeks of treatment with TB medications before you're not contagious anymore. This is the most important step you can take to protect yourself and others from tuberculosis. When you stop treatment early or skip doses, TB bacteria have a chance to develop mutations that allow them to survive the most potent TB drugs. The resulting drug-resistant strains are deadlier and more difficult to treat. The BCG vaccine isn't recommended for general use in the United States because it isn't very effective in adults.